And then, and so I'll pass it off to Felix to get us started tonight.
Hi, everybody. I'm Felix. I use he, they pronouns. Um, I am a LMSW practicing. Technically, I'm based in the capital region, but my agency is in Kingston. So I have lots of different clients from all over New York. I work virtually as like a psychotherapist at the moment. Um, some things about this program is so this is like a town hall format, so I really encourage everyone to like as much participation as possible. Basically how this is formatted is like I am here to facilitate conversation and discussion. I have some questions that are meant to kind of prompt that. And if you want to if you have anything to say or speak up about things, you can use the like raise your hand feature in the bottom of your screen under reactions, and then that'll let me know that you want to contribute to the conversation. That's a good way to kind of get your indicate that you want to speak. If for in the beginning, if there's like not anybody speaking at the moment, you can just like jump in, like that's totally cool. But if someone's speaking, and then sometimes we get a lot of people who like want to say something, so that raise your hand feature is really useful, so that I can kind of facilitate the conversation that way if I know that you want to speak. Some things about this program. So this is about sex positive and kink affirming social work. I think it's probably good to introduce myself as someone who does a lot of sex positive and kink affirming social work practice as in my job in like the clinical sphere. That's one of my primary populations. I work pretty much almost exclusively at this point with queer and trans folks, polyamorous folks, like kinky folks and racially marginalized folks. So that's kind of where my perspective is as a clinician, as a person practicing social work. I am super excited to like hear everybody else's kind of perspectives and where they're coming from, questions people have, and just like to kind of develop a really interesting discussion. We at some point, when was it, like a few months ago in the spring, maybe we did a panel on sex positive and kink affirming social work, where we asked questions to like a group of social workers who are practicing that. Is that recorded? No.
Yeah, I believe it is. Let me see if I can find it.
Yeah, if you could like find it or like put the link to that in the chat so that people who don't know who weren't able to access that before might have that for later if they wanted to watch it. So this program is kind of an extension of that, so that we can kind of talk about what the state of sex positive and kink affirming social work is right now for folks, what people's thoughts are about it, and like where do we want to go, and like where do we see social workers in this field and engaging in sex positivity and kink affirming social work. So again, especially in the beginning when discussion is kind of starting, feel free to jump in, and then once the discussion's starting to like pick up a little bit, and you want to say something and someone else is speaking, you can raise your hand. So I'm going to start with our first question, which is pretty broad. And I'm curious for folks, what does sex positive and kink affirming social work mean to you, and how do you engage in that in your personal social work practice? And I can sit here in silence for a long time. I'm very comfortable with that. Um, I can always jump in with like my thoughts about things, but I am also super here to hear other people's stuff. I see that someone has raised their hand. Yamit, and let me know if I pronounce your name wrong, but feel free to unmute and answer our question for us. Thank you for going first.
Hi. Great. Well, thank you for organizing this and getting us together today. And it's Yummeet, and it's nice to meet everybody. And I was trying to figure out how to update my name to have my pronouns. I use she, her. I couldn't figure out how to do it. I don't know why. So I guess I'll just jump in and put myself out there to get the conversation started. Sex positive social work to me is to make sure that we're validating and never shaming anyone for anything that they bring up, anything regarding sex in our work together. So whatever they're bringing, affirming and validating that that's their sexual expression and how they live, and never shaming. How I incorporate that is in two ways, and like sort of two hats that I wear, two different things that I do. In my day job, my 9 to 5, I work in geriatric social work. It actually geriatric mental health, and there's kind of a lot of like taboo and interesting things to talk about in geriatric among older adults and sex. And it comes up, it just came up the other day in supervision that we have a client whose family members actually who had to leave her church, which has been a source of strength for her for a long time because of gossip and rumors about her sexual activity and so choice of sex partners and choice of sexual activities as a, I believe she's a widow and an older person. So again, to make sure that we are affirming people's choices. And then in another hat that I wear, sort of a side hustle that I do, because we all have to side hustle, I do a lot of either premarital counseling or counseling with people in long-term who are like entering long-term relationships. And we talk about a lot of different things, communication skills and lots of different things, but a lot of it is about strategies for a healthy sex life in a long-term relationship. And again, infusing into that, just affirming that whatever makes the people in the relationship happy is what's great for you, and that there's no judgment and no shame, and helping the people in the relationship to communicate about that, because no two people are exactly the same in this manner, and in a long-term relationship, how to communicate about our needs. How's that to start it off?
Yeah, thank you so much for starting it off for us. Really appreciate that. I'm also one of the things that is in the list of possibilities for us to go through is the intersection between like aging populations and sex and how that works. So I'm so glad that you had brought that up. Another Liza, you also have your hand raised. I'm curious what your thoughts are.
Hi, I do. I am going to keep my video off because I'm sitting on a fire escape and I'm backlit and look like a blob. So I think this is probably better. I'm a social work student. I'm in my second year of my MSW in New York City. And I am currently actually taking a human sexuality and social work course, which is really, really rad. And something that we talk about a lot in that class is like just never making any assumptions about anyone's experience. and that even if we are sharing identities, right, like there's like a tremendous range of experience across all of the spectrums of our identities. And so even if you're like, oh, I'm queer too, like definitely not making any assumptions about like what this person's experience is. And something that my professor said today that I was just kind of holding on to, that is like, they repeat often, is like, let people tell you who they are. And like, never make any assumptions about sexual practices or relational orientations. If someone says they're gay, don't assume that they're only sleeping with members of the same sex or what have you, and just assume that everyone's definitions of things are unique and individual and totally subjective.
Yeah, welcome. I'm so glad that social work students are also in this room right now. I feel like that's like a really beautiful place to be and like be a sponge in learning. I guess I graduated with my master's in 2021. So I still feel like a sponge. So I'm really excited for you and any other social work students to be here.
Thank you. It feels a little like we're drinking out of a fire hose right now, but like in a good way.
Totally. Yeah, it's intense as a student for sure. At least that's how I remember it being as well. I want to highlight some of the things that people are saying in the chat as well. And also, like, if you don't want to use your voice tonight, you can pop things in the chat as well for anybody who wants to do that. In the chat, we've got allowing people to express their experiences without feeling judged. And then we've got sex positive social work means inclusive and non-judgmental verbiage and body language. And then there's a curiosity around kink-affirming social work and wanting to learn more, which I think is also super great. I'm curious, before I dive into like my personal definitions of those words, I'm curious if anyone else wants to share their perspectives. We've got another comment: being aware of your facial expressions, yeah, and nonverbal language when your clients are sharing. I think that's a really great point as well. I'm curious if there's any other things around this question, which is, sex positive, what is sex positive and kink affirming social work to you? And I'm curious if anyone wants to add anything before I put my 2 cents in. Okay. So I think a lot about how sex positive kink affirming social work is not only just about being non-judgmental. That's a huge part of it, right? Being non-judgmental, dismantling shame, I think, is a huge part of a lot of people's work. But also in a lot of cases, these are crucial tools that we can use in the work we have with clients. At least in my perspective, kink affirming doesn't just mean like not shaming a client for like things, but also being able to utilize, if that's a thing that they're bringing up, like utilizing that in the work, centering sex and centering kink as part of social work, I think it can be really important. I think there's a lot of ways in which like taboo feels a little bit hard to like navigate, like how as a social worker am I supposed to talk to my clients about sex? Like that can feel kind of like, I don't know. It is certainly scary for me sometimes as well, but it feels really important to me, at least in my perspective. And I'm also only one person, right? I'm just like a human navigating the world too. But in my perspective, right, I think that like we can center these things as well, not just exist with them, but like bring them into our work as well, if that's what our clients are seeking. I see a hand from Calix. Feel free to unmute. I'm curious yeah.
Yes, hi. My name's actually Severin. I'm sharing Calix's Zoom. We're both MSW students right now, but both also experienced in the kink community. And I would say um, I think partly like the issue with kink is that there's like a lot of misinformation or just like lack of education around what it can be. And so I would say that kink affirming social work would not only not shame, but actually acknowledge kink as like a really helpful vehicle for people like exploring themselves and like resolving like trauma even or like self-actualization and exploring like really healthy, like deeply consensual relationships with people. So yeah, just like adding depth and richness of experience to people's like relational lives.
Mhm. Yeah, I definitely could not have said that better myself. I think that that is like super important to highlight. Um, and I that feels like such an important piece of my work as a clinician, and that's something I think that's really important to also like highlight as well. So thank you for sharing that. I'm really excited to continue like deep dive in that tonight. Potentially. I see a hand from Cameron.
Apologies, my phone started ringing as soon as I had a chance to talk, and that wasn't gonna work. Um, yeah, I really appreciate what I've heard so far, especially Severin. And so a few things that I would also offer is that even if like you yourself is not like a participant in kink culture, it's kind of like with anyone that you work with, especially if they're from marginalized populations, is like doing the education piece, right? So that they're not having to explain things, can really go really far because there is so much diversity and exploration in kink culture. So like I think having a baseline understanding of like how the culture tends to go is really helpful. And then like leaning into, oh, that's something I don't know for myself. Like, would you be comfortable sharing what that's like for you? Right. And so like not expecting them to tell you and educate you, but to like be curious in a like, you know, positive and affirming way, right? But also I think there's just like some kind of like, for me, baseline practices in kink culture of like negotiating, and that like can be useful outside of that kink dynamic. And so I've seen some really good resources shared around lately that kind of is like pulling from kink culture practices to make it more like vanilla for everyone's use kind of thing, you know? And I think that knowing what that looks like is also helpful because it can be a way of connecting with the people that you're working with, who would love to have an opportunity to talk openly about this stuff without the shame, or the they're not going to know what I'm talking about, kind of feel that I think a lot of us experience when we're like wanting to talk to people about it, but just like don't want to take on all that extra labor.
Yeah, I think that's like a super excellent point that like I definitely want to like echo. Like, thank you, Cameron. I think it's really important to like this, like I think it's hard to expect every social worker to be fully knowledgeable about every single topic. And also, I think there's a level of responsibility for social workers to educate themselves to some level on many different topics. I have a personal bias that kink should be one of those topics. Um, but I mean, I think because there are some damaging, like without knowledge, there are some damaging ways that people can interact and like have kind of without that education like really run into like issues that can disrupt either a therapeutic relationship or a working relationship with clients, that can be really important. I see more than one hand. Let's see. Liza, your hand was up first.
I just want to piggyback off of what Cameron was saying. I think, Cameron, you made such a beautiful point. And in addition to the point about educating ourselves so that our clients don't have to do the emotional labor, I just want to add on to that, that I feel like it's also very much our responsibility as sex positive and kink affirming therapists, because so often interact with other people in the education sphere, in other medical spheres, in we are so frequently advocates, and we are so frequently case management, and we are so frequently like at the intersection of care for so many people. And so I think another really, really important aspect of this is helping be an advocate for our clients on subjects like kink, and like depathologizing that in the circumstances where that's appropriate, and helping kind of people understand that engagement in kink or what have you doesn't necessarily make somebody a sociopath like many people feel. And so I think that that's like a really, really, really important aspect of our job, that like standing up for people in classroom settings, in medical settings, in all kinds of settings, to say like, what you just said is kind of is incorrect, is misinformed, et cetera, and actually this can be a part of a very healthy sex life, et cetera.
Yeah, I think that's like a super excellent point around like, what does it mean to like have education, and then also be able to like navigate advocating for clients and people that we're working with through that education. Something that I want to kind of touch on, like, what is like, how do you get educated in these certain things? I feel like I want to like put a pin on that. I want to talk about that. Like, what does it mean to like seek education for kink affirming social work care, and like the pitfalls and like how that works? Because we definitely do not have a robust system to learn more about sex positivity and kink affirming care in the context of social work practice. But before we like kind of pivot to that, I do see Sarah's hand, so I want to open the floor to them.
Thank you. So I am a huge proponent of kink and sex positive care. I'm huge on clarifying and having people understand that the diagnosis and the DSM involving what looks like kink isn't. It's about the key phrase is creates distress. And I think people look at that and they just ignore it, and they think, oh, well, this is all just deviant behavior and it needs to be treated. And kind of like, how being trans was just removed from the DSM. And it's like, being trans is not a diagnosis, and so we treat the distress that is involved with, feeling not affirmed or whatever the case may be. And so I'm very huge on that. And also, I work for a big national company, and I am a supervisor, but I still do groups, and I work primarily with middle schoolers. And I'm sure lots of people immediately recoil in horror at the thought of me working with that group and then having this discussion, but I think it is important that even junior hires, they're into kink, and you wouldn't believe how much until you start hearing it, and especially in the queer community, because our company does have a queer specific cohort, and so it's just a whole new ballgame. And so them being able to have a safe space to talk about it, even being like 11, 12, 13, and reminding them about the key phrase safe and sane, and you know, as long as you are emotionally ready for that and understanding that there are emotional ramifications to not only kink, but just sex in general. And you have to be ready for them. And I've gotten a lot of pushback. In a previous job, I actually had complaints from parents about it, but my boss was like, you know, you need to be having these conversations with them. And if they're asking, then that means that they are well past needing to know it. And she was like, just maybe, you know, alert parents that that might be a conversation that happens occasionally. But I was very grateful for that attitude. And I think it did help me to have even more rapport with my clients. And I think it is just so important that we start talking. Like, they're not even hearing about any sex in most states. I'm in Indiana. Of course, they're not hearing about sex. They're hearing about how it's the devil's handiwork and so forth. So it is a huge, passionate subject for me, for sure.
Yeah, absolutely. I mean, I think you also bring like that excellent point around like how do we navigate these conversations, especially when it gets tricky around when our clients and the people we're working with are minors. Like that's also like another big thing to navigate. I want to kind of start talking about and pivot towards like education and like what that means for social workers. And one thing that I will say, so one thing that I will disclose around my, and this again, this is my just perspective, and I think it's important, important background for y'all to know and to hear when I'm just like speaking about this. I have a I have a background in kink, both like personally and professionally, and I am also active in the kink community, which if people don't know what that is, like kinky people get together and like form communities in lots of different ways, which can be also like important thing to know when we're thinking about care for our clients. But long story short, like I like am actively engaged in these communities, and what I see in the social work field is that there's not a lot of access to proper information and education about how to work with folks in a kink affirming manner. And even one thing that I've noticed is even like folks who like are like putting on CEUs, for example, around like this is how you work with kink of like kinky clients, or this is how you navigate sex positivity with clients or polyamory with clients. It's hard for people who are vetting CEUs to also vet the quality of the information that's happening in these CEUs, right? Because it's one thing if like we have a CEU on navigating anxiety or something, like where like we've got a large amount of people who like have expertise in this. It's a little bit trickier there. So sometimes even the CEUs that you get around kink affirming care is not actually great, and it's really hard to like figure out what is good information and what's not. Another thing I'm thinking about is how much information do clinicians need to know? Do we need to know the ins and outs and the definitions of all of the things that could happen in kink? Personally, I don't think that's necessary for every clinician. Like sitting down and getting like a definition of like every single thing is actually not necessary. It's more about how the attitude in which you navigate. How can we facilitate growth and exploration for our clients, even if we don't know every single thing? Another thing I'm thinking about there is like when we're thinking about kink, we often think about it as a different thing than sex education. So many social workers advocate for access to sex education for minors, but then stop and they're like, oh, well, but they don't need to know about kink. The reality is kink affirming or kink education should be wrapped into sex education, because minors are doing those things too, and they're going to make those mistakes. The same kind of risk awareness that needs to happen for things like STIs and protection and like that kind of stuff is the same things that need to happen now that kink is in the mainstream, which wasn't the case when most of us were teenagers. It is now in the mainstream, and I that's why I personally think that social workers need to be like more up to date, because people are trying things without education. So it's yes, I think it's great if everyone had like a kink education. That sounds awesome. But I think it's more about like, what are the resources? Where can we point people to navigate community education like for themselves if you don't have all of the information. I am looking at there's a lot of things in the comments right now. I'm hearing that it feels really daunting to navigate starting conversations around kink with people. I think that's something that we can talk about. I'm hearing like polyamory is part of that as well, and I think that is also a part when we think about alternative sexualities and sex positivity. Open relationships and polyamory is also a thing to think about there. I see Polysecure as a source. I think that's a great book to recommend to folks. I also see a comment, just because minors are curious doesn't mean they need to know. Not all are mature enough. I think that's a great question, or that's a great comment to bring up. We can have that discussion around like, what does it mean to like, as social workers, how do we deem that a minor is mature enough to know information or not, especially when they're already asking? Are we as social workers going to be the gatekeepers of information? That's something that like I'm actually curious about people thinking about, especially in these contexts. I see a hand from Michelle. I don't know if you were going to answer that question, Michelle, but you can, I'm opening the floor to you for whatever you wanted to say.
Thank you. And I apologize in advance. I have a dog that loves to bark anytime I get on a Zoom meeting. So I tried to sprinkle food throughout the floor here, but please bear with me. Yeah, I am actually here. I am a school social worker working primarily with high schoolers. Some of my students do go into the 19, 20-year-old category. But I work in an alternative school. I say both unfortunately and fortunately, most of my students are part of the LGBTQIA+ community. And I am a cisgender heterosexual female. And so I try to learn as much as I can, because quite a few of my students do come to me because they don't have anyone else that they can go to and talk to about things. And I find that very interesting. Like, at what point do we say, at what age should you be talking to children about, or adolescents about, things that they want to know about? And I've always taken the clinical perspective that if they're asking, they're ready to know. But am I right? I don't know. And I try to provide them with the support and education that they need. So that topic just came up. I just wanted to throw out there she goes. Throw out there that primarily that's why I'm here, is to learn and to know, how to respond and be the best support that I can to the adolescents that I'm working with.
Yeah, thank you for sharing. And I also really appreciate your perspective. I definitely have a clearer perspective that I hear for myself, but I'm also one person too, which is why I like these town halls, so that we can kind of hear everybody else's perspectives as well. I also see that there are several more people with their hands up. So Jacob, do you want to
Right.
take?
I'm sorry, before Jacob goes, I wanted to clarify why I said unfortunately and fortunately the children in my school, because it's unfortunate that it shows that our schools are still not equipped for our students with these needs, and their needs are not being met in a traditional school setting, that they're coming to a program like mine. And while I'm happy that it's there, it still makes me sad and extremely frustrated that our schools are not able to support them.
Absolutely. I appreciate your clarification. I felt like that's what you were trying to say. I'm glad that you clarified just in case anyone like didn't understand. Okay. Now, Jacob, you can take the floor.
Thank you. Yeah, I guess was gonna follow up on that. I used to be a teacher before I was a social worker, and so definitely I had kids coming to me. I did like a lot of LGBTQ education for them, and they would definitely be asking questions. So I feel like I, as a social worker now, and like then as a teacher, like I want to be the one to educate what information they're getting, right? Because if they're not getting it from me, that means they're going to either turn to the internet or they're going to like turn to adults that maybe don't know about like what it's like to be queer, and they might not be like giving them like appropriate information, right? Like if they're turning to someone that's like homophobic, like hopefully that wouldn't happen, but I would want to give them like a positive like the positive information that they need about like whatever it is, like kink, being safe, like anything. So I feel like if they're asking, like I definitely want to be answering, and in like an age appropriate way, you know, like I had different age groups. So if someone was younger was asking, like I would definitely tailor it to like what they might need to know and what they were asking at that point. So yeah.
Yeah, thank you for I dropped my pen. Thank you for sharing that. I think like the key word you said was age appropriate. And I think like there's like this like kind of slippery slope around like, well, like how do we deem like what's appropriate for minors? And something around like, well, something I hear a lot from people is like, well, you shouldn't talk about being trans or like LGBT with minors because like that's not age appropriate for them. That's not, they can learn that when they're older. So I'm curious around where's that spectrum of like, is queerness not appropriate for children? Is sex not appropriate for children to hear? Is kink not appropriate for children to hear? Like these are questions that people have a lot of different opinions about, right? I think there's definitely, I personally have an idea of what is age appropriate and like how to do that kind of age appropriate work. I am seeing lots of hands. I am so loving all of this participation from y'all. Like I love it. So I think the next person in line is Shanetta.
Hey, so I was the one who like wrote that, and I think I'm speaking about it in two ways. One, from a social worker, I definitely understand the accessibility of information on a lot of things, because I definitely feel like school picks and chooses what's important, and a lot of the times we should be talking about hygiene, we should be talking about being able to say it's okay to say no just as much as it's okay to say yes, and to provide information if people are asking. When I worked for many a years in schools, outside of schools, with adolescents of all different modalities, they asked things because they wasn't getting it from their parents, and I understand that. But I also know when and after school that parents were very furious about certain information being displayed to their children. So I do agree, like, you know, the appropriateness can be very tricky, but also too, I feel like as a mother of a daughter who I have always been very upfront with her about information, about sex, about STDs. She had to study STDs and understand many concepts because my mother taught us when we were younger. So I don't have a problem with it, but I also feel like by the time she entered high school, she had been exposed to more. She was a arts major, so she was exposed to more of the Spirit Week and the LGBT community, and her and us being a family that love colors. Now the colors meant something different. And I feel like I don't mind the information, but I feel like because she got into high school, now the focus is more everything around identifying with everybody because of the LG community being very prominent in her school, that I feel like it took her off a track of just focusing on high school. Like me in high school, yes, we learned things, but it was like, okay, well, what are you doing in school? So while you spending time trying to figure out about kink, or did you find out how to get a scholarship? Did you find out how to do these other things? And that's to me the nature versus nurture. Like your kids come from the household and you have that access, because she can talk to me about anything. I don't have a problem. But now you say just because someone's a social worker don't always mean that they have the positive way in which they give information. Everybody is not, not human. You're not, just because you're a social worker and you are in a social service means that I work with social workers endlessly, and not everyone is like compassionate or thoughtful to provide that information. So I definitely don't think that you should ever gatekeep. I definitely feel that it's a tricky thing about what's appropriate and maturity and all of that. And I'm not biased of any kind of lifestyle, but now I'm seeing that it's focused on Spirit Week and wearing colors and identifying, almost like how when we grew up we had to identify with the Bloods or the Crips in order to feel like we was a part of something. But now where is the actual schooling? Now when it's like grades, what are you doing when it comes to that? So now just because the information is there, like, oh, let's talk about kink and let's talk about this or talk about sex or talk about anything, not even just kink that's the topic here, but just anything that has strayed from now, like, well, what are you going to do? Like, how are you going to survive in a capitalist world on top of now that you learned about kink? So I love everybody's responses, and it's just that my thought is like we just stray from so many things, and every time it's an information, it's always that somebody is not getting something. You could get information from a social worker and hear it and still go online, or you could have heard it from somebody else and just been like, oh, I'm gonna go Google it and ask somebody else. There are families that it's taboo, but I also feel like there's things that are not taboo, but it's pushed in so much, like you gotta be a part of it. It's like losing virginity when I was growing up was major for everybody. Like you have to be a part of this, that you lose focus on everything else. And I feel like that's what needs to be included when people are passing on what they feel should be said just because it's being asked.
Yeah, thank you for sharing your perspective. I definitely agree on some points around that. Not all social workers are equipped for these kinds of conversations. And I'm very skeptical about the idea of social workers being able to have all of these conversations. I think most of us are not educated enough and are not able to like really come from these compassionate and informed places. Some things I do want to say that I feel like are important to put out in the room. I, at least for me personally, feel a little bit uncomfortable with the comparison around identifying with different sexualities or genders and comparing that to like wearing colors around like identifying with gangs and things like that. That feels like two very different places. So I just wanted to put that in the room, that feels like a comparison that is super unfair. I do think that it's really important to kind of balance what are children's priorities around like finding community, engaging in sex, and being students, right? And I think that like minors, teenagers can contain a lot of multitudes, and I agree that it's hard to like survive in this like capitalist world, and like the oppression that we face for many of us who are marginalized is really, really, really difficult. And it can sometimes feel like we just gotta focus, gotta get our work done, and how do we succeed? And that we do that through getting scholarships, focusing in school, and putting all the rest to the side. I have the personal opinion that things like finding our identity, finding communities, and engaging in things that make us feel good can often help us survive the oppression and the discrimination and the marginalization that we face. So I think it can be a hard balance. I definitely appreciate you sharing your perspective around those things. We have a lot of people in line right now, so I am going to go to Michaela.
Hi. So first off, I just want to thank you so much for like having this conference and talking about this, because it is a taboo subject. I guess like as you've kind of read my comments and kind of seen things, I guess I feel very comfortable in a group setting, kind of talking about like kink and sex positive language. Even in an individual setting, I feel like I'm the strong suit of mine that I have my skills and abilities is sex positive language. But just when it comes to navigating like talking about kink, maybe in an individual setting with a client, maybe for example, it was brought up that it can be therapeutic. It can be like a different way in which maybe you're talking about like sexual trauma with the client and or different kind of things, and then you're kind of like coming up with recommendations. It just feels like the idea of mentioning kink individualistically like with the client feels really daunting, and I was wondering like how would you go about navigating that and like determining like what verbiage to utilize, because what if it's reciprocated negatively by the client? You know, you can do your best to read the room, but if it's taken negatively, especially if you have supervisors that aren't going to be in agreement with your maybe verbiage or your maybe liberal ideas, it can get you into trouble if you don't do it right.
Yeah, I think that's a super great question, Michaela. I am lucky enough to work at a place where like I talk openly about kink with like so many of my clients. I talk openly about kink in my supervisions, and I also happen to run like a group consult group where like the other clinicians at my practice come together, and I run this group around polyamory and kink and like how to navigate those subjects with my clients. So I get to come from this perspective where I feel very, very comfortable in this exploring that in the professional setting, and I understand that that is not the case for everyone. Like that's not where a lot of people at, especially if you're like a school social worker or you're working in community mental health. You've got supervisors like really on your back about professionalism and whatever that means. So I want to acknowledge what feels almost like a privilege for me where I'm sitting at, where I can do those things. Some things that I will say, and also like if other people have answers to this question, I am like really would love to hear everyone else's answers too. Some things that I think about are like when especially if someone is bringing up kink, maybe they are beginning, they don't have a lot of language around it. I think about risk assessment first and foremost, right? Are they being safe? So the thing about kink is like there's nothing about kink is actually safe emotionally, physically, and you can be as safe as possible. It's about risk mitigation. So asking questions like if I have, let's say, like a young adult who's like, oh, my boyfriend choked me and I really liked it, but I want to talk about how that feels and like what that means to me. You can be like, okay, so like what, like, have you thought about the risks around choking? Like, have you been able to like be educated around like these types of actions? Like, what makes you feel good about those things? What are you worried about? And just kind of explore that. You don't even have to be like, what you're doing is kinky and like you, I mean, you can do that, right? But you don't initially have to even bring up that word kink, because that can feel kind of taboo, but more just exploring how people feel about it and how like if they have the resources to, one, communicate with their partners about what they're doing, and two, find the information around being safe. Even things like if someone brings up things like spanking or something like that, there are risks to that as well, right? So we can talk about it in ways that feel open and caring, but not like what you're doing is dangerous and it's scary and you need to be careful, right? There's like a balance around compassion that takes some level of some education around risk assessment, right? Like I don't think that you need to know all of the risks about every single thing, but to kind of learn how to pick up red flags. Like, does this person know how to communicate? Can they advocate for themselves? Do they feel like they have the resources to navigate risks before they do a thing? And or if they do a thing that feels icky, can they navigate that as well? Like basic things around negotiation, communication, aftercare. Those things are also things that we can like learn as clinicians to invite into like a session. Like if someone's like, oh, I had this really great sex, but like afterwards I felt kind of like icky, you can be like, okay, like what did you do to take care of yourself? How did you and your partner connect afterwards and cool down from that? Right, those are kinds of questions that you can ask that feel like you're engaging in that conversation in a non-judgmental way, while also like encouraging exploration around that. I am curious, I could probably go on I could answer that question in an hour if I wanted to. Something also to know about me is I do kink education. I like teach like things like kink 101s, or like I do workshops on the intersection between kink and mental health. So I could talk forever about this subject, but I'm gonna reel it in for like a hot minute because we do have some super patient people waiting with their hands raised. So I'm gonna go to Jacob.
Oh, sorry, before we transfer to someone, I just wanted to ask, like, if, since you do all these wonderful things and you said you are a virtual person, if maybe this could be put in the chat or something, like in regards to how we could access your workshops or refer you to maybe clients or like something like that. That would be kind of cool.
Sure, yeah. I mean, someone just put in the chat, OMG Felix, are you hireable? Yeah, I'm hireable. I'm very hireable. I have lots of experience being hired for different workshops for different things. I guess can use this as a time to pop my email in the chat in case anyone wants to reach out to me. I did not necessarily mean that as like a plug for myself, but we'll do that. I'm here for it. If that means furthering the education around kink-affirming care, that feels important for this. Okay. So thank you, Michaela, for that question. Felt really important to highlight. Jacob.
Love the shameless plug. Always here for it. I was gonna answer Michaela's question too. I wrote my thesis about consent in the queer community and like masculinity and violence. So it's like something that like I'm very passionate about. And I participated in NASW had these workshops in New Jersey on unwanted consensual sex. And part of that was like talking about helping your clients create a sex plan. And so really just like creating mindfulness about the sex that your clients were having. I actually just started talking about that with one of my clients today. Like, are you having sex when you want to have sex? Like, are you having sex because like you feel like you should? Like so many questions, and I just found some of my notes from it so I can pop in some of the questions into the chat. But they were just talking about like creating a plan to decide like when do you want to have sex? What do you want to feel before you have sex with someone? Love this question. How do you disappoint men who want to have sex with you? That was like a really good one. Yeah, and like what are the consequences for you like when you do have sex? And they were just, I thought it was really cool because they were just talking about like the sex plan can literally be anything. It can be like go out and have as much sex as you want and then come back and like process that with a therapist. Or it can be like I only want to have sex like after the fourth date, and like so like there's just like such a wide range of what that looks like. But I feel like that's like a really good place to start. Before you even like have to get into the kink part of it, even like just like building like a general sex plan, and then like as part of that, like where does kink fall into that? Or where do like certain practices, if you don't want to use the word kink with your client, like where do certain practices like fall into that?
Yeah, I think I love that idea. I think like being able to like set up those kinds of plans feel like a really good way to structure something with clients. I think like when we think about navigating bringing up these topics in session with clients, it can be tricky sometimes to like I know I certainly have had experiences where like a therapist has asked me a question that like felt really, really icky. And I'm like, why did you ask me that question? And I've had experiences where therapists have asked me questions about like kink, and I've been like, yes, that feels like a really good way to continue to deepen my understanding of myself or and explore and like those kinds of things. When we are thinking about navigating these things with clients in whatever capacity, I think it takes some practice around navigating how to bring things up in session. And I will say you'll probably make a mistake or two, and that's probably fine too. I mean, it might cost you a client relationship. You might make a mistake that like breaks the relationship, but I think part of the journey around this is building up a skill. And I think it's okay to make mistakes, given that some of these mistakes might be bad enough where you ruin the relationship, and that's real. But but like you can't expect yourself to be perfect at this every time. So I just wanted to put that in the room. Okay, so the next hand is from Calix and or Severin.
Yes, hi, Severin again. She, her, by the way. Yeah, like to further answer like Michaela's question about like when to recommend, like I personally would stay away from like introducing the concept of kink in a, like maybe other people have different things, but I think it's more like if they're bringing up something that is kink or kink adjacent and like you ask probing questions about that, I think that's chill. But like I would like, I don't want it to make it sound like earlier I might have been like recommending like kink as like a clinical intervention that you might suggest to someone as like a way of like resolving trauma or something. Because it is like it's not something that you can supervise or control or like even educate deeply about as a clinician in that relationship, and that's not really our role. But yeah, I do echo like what everyone else said about like assessing risk and like trying to find good information. I will say that like I think of like kink or even like polyamory as like all of the basic like self-knowledge and negotiation skills that come with like any kind of relationship, but like dialed up to 110. Like you just need to like, I feel like to do kink relatively safely, it takes just like a really strong knowledge about what your limits are, what your triggers are, what you like and don't like, and what your boundaries are with other people. And those are things that sometimes can only be explored in the space of kink. But like it can and will like bring up really hard like emotions and like unresolved things for people as they explore it. And so I would say like if someone is diving into it, like the best thing you can say is like admit your level of knowledge or ignorance about it if you're discussing it with them. Like don't try to present yourself as like having more information than you have. And just like setting the expectation that like, yeah, this can be risky, and like as with any kind of personal growth, like there will be consequences that you cannot predict or anticipate, and like it can be hard. And so like having the kind of like emotional regulation skills and grounding techniques that you would use for any kind of like traumatic experience can also apply to kink. Like knowing how to get back in touch with your body, like notice the sensations that you're feeling in the aftermath of it, and being able to process that with a safe person after are like I think the biggest things for you to focus on as a therapist who like is not experienced in kink yourself.
Yes. Yeah, I want to like highlight pretty much everything that you said there. I think those are really, really excellent points. I think something that's really important that I think social workers, maybe this is my judgment on social workers. Again, I'm a social worker who's very skeptical of social work practice as a whole, but we tend to like do this thing where we like attend one CEU and then think that we like know how to navigate the whole like the whole genre of whatever we just learned about. So thinking about your scope of practice is really, really important there, right? So some of the work that I do as a clinician, where I use things like kink as a therapeutic tool, where I'm helping clients navigate therapeutic issues and work through them and process what they're doing in kink, like, for example, learning how to set boundaries through practicing that in kink. One of the reasons why I can do that is because I have the scope of practice of both being personally and professionally involved in kink and professionally involved as a therapist, and I've merged those two experiences together into this practice that I can do. I would say that that is not a practice that people can do if you don't have both of those pieces, right? When we think about the kink affirming care for clinicians who don't have a professional background in kink, that is going to look very different, and that's going to look like encouraging folks to go to different resources, and encouraging folks to do self-introspection, community, like finding community and social support, and helping people process kink in a way that's like non-judgmental and shame dismantling. And you can center kink in the work, but I wouldn't say that you can work outside of your knowledge. And I think it's really important to be like, I actually don't know about that, because like I think first a lot of us, like, we might know how to process things like, oh, like I like it when someone's like rough with me in bed, versus like I am navigating very complex kinky dynamics, and if that's not your scope of practice, or like your knowledge base, it's important to talk about it, and like be honest about where you are. I think that's really important, that we are upfront about how much we know and how much we don't know. So I think that is like a really incredible point, Severin. I know. Okay. So let's see. Let's check the time. So it's already 7. I was planning for this to be about an hour and a half-ish if the conversation really got going, which it sounds like we're really like engaged in this conversation, which again, that I'm so here for and I love. Some things that I want to, let's look at the chat a little bit. So I think there's a fine line of self-disclosure with clients to build rapport with them. I think that is super true. One of my favorite topics to talk about is like self-disclosure, what that means, and how do you navigate boundaries in your practice? Well, like thinking about that, that's a question that we could go into actually in the next 30 minutes. We've got someone talking about the sex plan, so definitely check the chat for the notes around the sex plan stuff. There's a lot of good things in there that I think we should highlight. There's a question on how do we build our knowledge moving forward when kink affirming practice seems so taboo? I think that's a great question. I currently don't have any resources around social workers who are I can't recommend anyone who's doing social worker, like kink affirming social work practice as like a CEU right now. I don't have any recommendations for that, because I haven't run into any that I actually like. Maybe there are some that other people like and you want to like drop in the chat around it, like go for it. I personally haven't found any that I personally like. I do have a ton of resources around like if you want to learn more about kink, you can I think it's useful to have like a base knowledge around like Kink 101, things like that. And there are plenty of resources around it. I think I have a list somewhere that I can drop in the chat. We can do that. But I am also curious. I want to throw that question into the group because it sounds like there's several knowledgeable people in here that I'm loving a lot. For folks in the group, how do y'all build your knowledge around kink affirming practice in your social work practice? And while y'all are thinking about that question, I'm gonna go find the resources. So we might sit in silence for a hot minute, but that's okay too. Okay, I see something in the chat. Oh, we've got a hand. Jacob, go for it.
I was gonna ask a question, if that's okay.
Go for it. Yeah.
I guess I was curious. I don't know how to exactly phrase it, but I guess I'd be curious to hear from you or others in the group, like, how do you focus like kink affirming practice in like a society that has like so much like patriarchal trauma, and like there are like kinky practices that are like replicating of that. So like how do you, right, like if someone has like a rape fantasy, or like how do you handle that without it like getting conflated, I guess?
That is a wonderful question that I would love to dive into. I want to do that. And also, if anyone wants to answer that before me, I'd also love that too, just because my voice is loud here and I want to recognize how much space that I take up as facilitator and also a passionate kinky social worker. But I see Cameron's hand, so go for it, Cameron.
Hey. Gosh, that's such a good question. Because I also like my day job is housing unhoused youth who are experiencing like so much DV, right? And have been through these types of experiences, right? So like caveat there. Because like aside from that, right? Like as someone who is part of kink culture, and like supports people therapeutically with that as well, such as different kind of job, but kind of getting to the question, that I have people share with me, right, that like they have taboo kind of like fantasies, interests, practices, and so on, which can be I'm losing the word for it, but like trying not to like put my own feelings about it, right? Like, oh, in a culture where like rape is like we're advocating for survivors, and then you're like willfully wanting that experience, but it's also in a consensual way, right? Like you are enthusiastically like expressing that is something that you are interested in, right? And so like I had someone share that with me, and so I wasn't taking that as an opportunity to like unearth trauma, like where does that come from, like we should work through that, I'm like, oh, that sounds very interesting, like how would you want to bring that up with a partner, right? Like how would you like do you feel like you're comfortable in your relationship with someone, or like how do you want to, just kind of like giving more questions to kind of like prompt the like where do you want to go with telling me with what you just shared, what do you want out of the conversation now that you've brought that up, right? So I mean that's just like something that like, because for me I'm like, for disclosing to this group, I'm like, oh, I enjoy that too. So like for me, I try not to like endorse anything that people are sharing with me, or that what they want to talk about, just because I'm like, oh, I can relate, like in my head, yes, sure. And like what actually comes out of my body and mouth to support that person is more about helping them build those skills for communication. Because again, kind of to my earlier comment of like going into any practice that involves another person, you know, whether you're inviting like a pain sensation, or you're inviting a dynamic where you are you know, relinquishing control to that person, it has to be with that we've had a conversation about it, we've had boundaries set, we've discussed how I can tell you when I'm done, we've discussed how to support me after the experience, right? I've created, or I'm attempting to create, some kind of community where I can talk about how this is going. So I have maybe this therapist and also maybe these friends, you know? And so I think that's kind of where my thoughts kind of went after Jacob's comment and question there.
Yeah. I think that that is really important. Around that, like, what does it mean to like show up in those ways, like around people bringing you these things? Something that feels really important to me, and this might be other people's, there's an invitation to disagree, but kink does not exist in a vacuum. There are lots of things that make us horny that wouldn't make us horny if we lived in a liberated society. If our society didn't exist, if our society did not have oppression, there are so many things that wouldn't be sexy anymore. Like that's just like real. So like we are engaging in patriarchy and oppression and playing with these topics when we engage in kink, and that's part of the reason why I think it's so important to have this like informed intersectional lens around kink, and as a therapist or a social worker or whatever capacity that you work in, because kink is one of the ways that we explore these things. So like, yeah, there are a lot of things people might bring to you that look like patriarchy, and it potentially is playing with patriarchy as a reality, right? And that we can kind of continue to explore that. You might find clients navigating other types of oppressions as well, whether that's like experiences around sexual assault or racism, transphobia, homophobia. These things are at play when we think about power dynamics and playing with them. Those are real. Those things are real, and I personally think that like that's something that like is to be explored around when we think about exploring kink in session with clients, is like the same way we might navigate other ways that oppression shows up in our lives, right? Like how are we exploring these things? I think that like you could do a whole 2-hour workshop on that, right? Like how do we explore these things? That's so like your question, Jacob, like is a great question that we could probably spend a bajillion years trying to like unpack. And I thank you for bringing that into the room. I'm about to put in the chat basically a list of different resources. Some of these resources might be good for your clients to send to your clients, right? Like one section is like porn and erotica that is queer and kinky, right? If your client is trying to seek other media around like how do I like seek out these things that feel good that aren't like weird websites on the internet, right? Like you can suggest those things if that is within your scope of practice and you feel comfortable with that kind of stuff. But there's also things like different classes that you can send them to, like online platforms for classes. And then something that I find actually the most accessible are things like podcasts, right? Where you or your client can listen to things and be like, learn more about it. I personally think that it's great for for social workers to maybe listen to podcasts. My favorite ones that are on this list are things like the Dildorks, which is a queer and trans kink and polyamory podcast, sex podcast in general, American Sex and Disability. American Sex is a kink podcast, and Disability After Dark explores kink, sex, and the intersection with disability, which I think is really important for everyone to learn more about. But that's my personal, most accessible way to learn more about these topics from other people who know so much. And there's also other books in there that you might want to like either check out, or if your clients are like, hey, I want to learn more about these different topics. How do I get resources to educate myself? These are good things. So I just popped that in the chat. I know that Calix and or Severin had their hand up before. I don't know if you want, it's now gone, but I'm curious if you wanted to say anything.
Oh yeah, just adding one thing to what Cameron said. Like when it comes to negotiations around like especially risky things, it might be helpful to like recommend that those negotiations happen like with some time separation from like when the activity might actually take place, so that there's not like heat of the moment kind of emotions like informing the ability to like get really specific with the negotiation and like discussion of like what specifically is going to be involved in a scene. That's
Yeah,
all.
totally. I think that's a great recommendation. I think actually that that kind of helps me expand to a further point, and at least my conceptualization of kink and sex and things like that. Oh, I love the Crash Pad series. Sorry, that was in the chat. I got distracted.
Hell yeah, they're great.
Yeah. But is this idea that like when we're making informed consent decisions, part of that is that when we think about, we don't want to make decisions under the influence, so when we're intoxicated, and sometimes what I call horny mind could be considered an intoxication, where you make a decision that maybe you wouldn't make when you were not feeling that way. Any kind of altered state, whether that's drunk, high, or like horny, like those kinds of things could be considered risk factors when thinking about when you're negotiating things and stuff like that. So I think that like as clinicians, you can kind of think about like, what does it mean to have informed consent, and like how do we navigate these different spaces using those different factors. That's another thing to think about, risk, for sure. I think, oh, the one thing that I wanted to say, because we are almost, we've got about 10 minutes left before I want to like cut off our conversation so that we're kind of respectful of everyone's time, is that the way that I also want to acknowledge that this was sex positive and kink affirming social work, and we skewed heavy into kink affirming social work, which I think is fine. I think that speaks to the real need around this topic, so I'm here for it. I'm very passionate about it, so I let the conversation go there as well, and I want to acknowledge that. But something that I want to kind of think about is for social workers who want to be kink affirming practitioners or providers, I think one of the best places you can focus on is those foundational skills around communication. So those are things like negotiation and things like that, and like just those basic communication skills around sex, relationships, emotions, feelings, and that includes introspection, right? Like how, as many of my clients are like suffer from like chronic fawn response or like people pleasing, right? Where they don't actually know what they want. So how do we help our clients develop an ability to sense into what they want and what they desire so that they can better navigate kink, sex, etc., like with more tools on their tool belt. That feels like a foundational skill in my mind. Helping clients navigate boundaries and self-advocacy is, I think, a huge portion of that, right? So like that is the place to focus in my mind the most about navigating kink-affirming care. Like at the very bare minimum, that's a place where I think about the most. Yes, like the list of resources that I just popped into the chat, I think are important if you especially if you just want to learn more about it, or if you want to prepare yourself for like people talking to you about things that you are like, whoa, like I didn't even know this existed, right? Like coming into a non-judgmental and a shame dismantling compassionate place does include learning a little bit more about kink, I guess. Like that, I think that's important too. But it's those foundational skills that's most generalizable, in my opinion. And I think that that's a good place to focus at first. I think maybe other people could have different ideas around that. I'm curious if so we have 7 minutes left. The funny thing is that we had 10 questions and got to one of them. So that is super fun. I will consider that still like a success because I really appreciate the conversation, the depth of the conversation we had, and where we went with our conversation. I'm curious if anybody has any final thoughts, anything like burning questions, or anything that they want to put into this space. For the last few minutes of our conversation. Yeah, Sarah, go for it.
I put it in the chat, but I just wanted to reiterate Dr. Lee Cray. She is a certified sexologist, and she is an expert in the field of the LGBT community, like training and education, and she is available. She does consulting work in those fields as well as neurodiversity. She is not a social worker, but there are good people that aren't social workers occasionally. But she worked for my company, which is Charlie Health, for over a year. She just left so that she could work on her consulting business more. But if you're interested and need more training, she does do that. And she's very engaging. She's a trans woman. So she's got that going for her as well, like that extra layer. So I do highly recommend her, and tell her I sent you too.
Thank you for that, Sarah. I think if you want to deepen your knowledge around sex positive and kink affirming social work, especially if like, let's say you, I don't know, have the ability to pay people, do that, especially, and this is my bias, but I also will pretty much say that I'm correct here. Paying queer and trans people around the subject feels like the best place to go, personally. I think that makes the most expansive and the most like kind of informed view of things, right? Like paying marginalized people who are experiencing those like marginalizations and all of the depth and the complexities around sex positivity and kink affirming experience and like kink experiences, right? That feels like the place to go. I also think that feels important when we're thinking about educating, like more education around these things. That feels like the best direction. So let's see. So we're just about out of time. I want to open it one more time for anybody else who has one last thing to say. And otherwise, after that, we'll end for the night. But anyone else have anything that they want to share? Okie dokie. So it sounds like we are good to go. Thank you so much for taking the time to show up here. I really appreciate it. I hope that it was informative and enjoyable and engaging for y'all. And thank you so much. And I hope y'all have a good night.
Yay, thank you again, Felix. Thank you all.